If your stomach looks flat in the morning, but by the end of the day feels tight, swollen, and uncomfortable, you are not alone, and this video is for you. Many of my patients assume that bloating is random, but most of the time, there's a tangible reason, and today, I'm going to give you 5 practical tips that you can implement immediately to start feeling better. Because bloating is one of the most common GI complaints out there. My patients will say, "Dr. Glover, my stomach feels tight. I look pregnant at the end of the day. I feel uncomfortable after large meals," or "I'm constantly gassy." And the frustrating part is that bloating in general is a very vague symptom. It's not always severe pain, obvious constipation, or just gas. It can be pressure, fullness, swelling, or visible distension that can make my patients absolutely miserable. The American Gastroenterology Association actually points out that belching, bloating, and abdominal distension are highly prevalent GI symptoms and among the most common reasons people end up in outpatient GI clinics. I see bloating in clinic every day. For those of you new to the channel, my name is Dr. Matthew Glover. I'm a clinical gastroenterologist, GI doctor working in Las Vegas, Nevada. And today, we're going to talk about bloating, what it is, why it happens, and 5 practical tips that you can implement immediately to see improvement. And one of the reasons I wanted to make this video is because people often get bad advice on bloating. They either get told that it's nothing to worry about, or they get told to buy 5 supplements, a probiotic, 3 powders, and some detox tea that altogether costs more than a monthly car payment. When people say bloating, they usually mean one of 2 things. One is the feeling or sensation of bloatedness, meaning fullness, pressure, tightness, or discomfort. This may or may not go hand in hand with number 2, which is visible distension, where the abdomen actually appears larger, often later in the day. Sometimes these 2 happen together, sometimes they don't. And that matters because it reminds us that bloating is not just one single disease. It is a symptom with multiple possible causes. Tip number 1, slow down when you eat. This tip sounds simplistic, but it matters, and I see it all the time in my patients with bloating. A lot of people eat like they're always late for a flight. Huge bites, barely chewing, talking while eating, and washing it down with a carbonated drink. That is a great setup for bloating. Most of us do not realize how much excess air we are putting into our GI tracts when we inhale our food and drink carbonated beverages. There is excellent physiologic evidence for the fact that swallowed air can contribute to abdominal symptoms. And in fact, impedance studies have objectively demonstrated excessive air swallowing, aerophagia, in patients with bloating and abdominal distension, and other related symptoms. A 2009 study from the Journal of Clinical Gastroenterology and Hepatology found that the most common symptoms associated with aerophagia were bloating, abdominal distension, and constipation. So one thing you can implement today is this: sit down for meals, chew your food, and enjoy your meals. Try not to treat every meal like it's an emergency, because oftentimes the problem is not just what you're eating, it's how you're eating and how much extra air you are bringing along for the ride. Additional factors I commonly see in my patients leading to aerophagia and bloating include chewing gum throughout the day, drinking through straws, and carbonated drinks. These are common ways individuals are unintentionally getting excess air into their GI tracts. So look out for these risk factors as well. Number 2, cut back on the biggest bloating trigger foods. Now this is where the evidence gets stronger. There are some very common bloating trigger foods that are worth targeting first. The big category here is fermentable carbohydrates, what many people know as FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. That's a mouthful, I know. These are carbohydrates that can pull water into the intestine and then get fermented by gut bacteria. This can lead to gas, bloating, and discomfort. The American College of Gastroenterology Guidelines for IBS recommends a limited trial of a low FODMAP diet to improve global IBS symptoms, including bloating. You can find many FODMAP diet guidelines all over the internet, but I will leave a link to a document from the University of Virginia in the description for this video. The main mechanism of action for low FODMAP diets is thought to be a reduction in small intestinal absorption of these osmotically active short-chain carbohydrates, resulting in diminished intestinal water content and downstream effects on colonic fermentation and gas production. And if you want actual trial data, there was a 2016 randomized controlled trial comparing a low FODMAP diet to a modified NICE diet. NICE diet meaning National Institute for Healthcare and Excellence in patients with bloating. Both groups had some improvement, but the low FODMAP group had greater improvement in individual symptoms, especially pain and bloating. In this particular study, 40 to 50% of patients reported adequate relief for their symptoms, including bloating, following a low FODMAP diet. There are also broader evidence summaries showing similar findings. A 2017 systematic review and meta-analysis from Italy concluded that a low FODMAP diet can favorably impact IBS symptoms, including decreased abdominal distension and bloating. A meta-analysis is where multiple studies are combined and analyzed. And this particular meta-analysis included 6 randomized controlled trials and 6 cohort studies. So what does this mean in real life? It means that if you are bloated all the time, it's worth looking at common triggers like onions, garlic, beans, dairy products, wheat-containing foods, certain fruits, sugar alcohols, and highly processed foods. It also means cutting back on carbonated beverages. Carbonation is a very reasonable first move because even if carbonation is not the only problem, voluntarily filling your GI tract with gas is usually not a winning strategy. And I want to emphasize, I'm not saying that all these foods are bad foods. I'm saying that for some people, many of my patients, these foods are reliable bloating triggers. So instead of randomly cutting out everything, pick the most suspicious offenders and cut these out first. And as a quick aside about the FODMAP diet, most physicians I find do not appropriately explain how this FODMAP diet is meant to work. The way in which the diet is meant to work is that you eliminate all these FODMAP foods, which is actually quite restrictive. But this is not forever. Slowly add back the eliminated foods one by one, week by week, in an attempt to isolate the trigger foods in a scientific manner. Keep a food log or diary. Tip number 3, make sure constipation is not the real problem. This is a huge one. A lot of people come in saying, I'm bloated, but the deeper issue is actually constipation. If the exit is broken, stool and gas will build up, resulting in bloating, discomfort, and distension. And constipation does not always mean you never go to the bathroom. Some people have a bowel movement every day and are still constipated because they are not emptying well. They are straining, or the stool is hard, or overall transit is slow. You want to be shooting for Bristol 4 on the stool scale. When stool hangs around in the colon, that can absolutely contribute to bloating, pressure, fullness, and more fermentation. The AGA-ACG guidelines on chronic idiopathic constipation emphasize that constipation is common and significantly impairs quality of life. So when my patient says, I'm bloated all day, one of the first questions I always ask is, are you skipping days between bowel movements? What is the quality of your stool? Are you straining? Do you have a sense of incomplete evacuation after a bowel movement? Because if constipation is the hidden driver, treating that may help a lot more than chasing random food sensitivities. Now, this is where also people tend to mess up with the fiber. They hear constipation and then immediately decide to eat a mountain of raw kale, bran, or other fiber gummies. And then they get even more bloated and swear fiber is a scam. The reality is much more nuanced. The IBS guidelines recommend soluble fiber, not insoluble fiber, for global IBS symptoms, including bloating. Soluble fiber dissolves in water, which forms a gentle gel, which can help regulate digestion and is often better tolerated because it is less harsh on the gut. Insoluble fiber, on the other hand, does not dissolve, adds bulk, and can speed stool movement, but in people with bloating, it can sometimes create more distension and discomfort, which is why soluble fiber is usually the better starting point. A 2022 meta-analysis found that fiber supplementation improved constipation, with psyllium being one of the more useful options. However, fiber can also increase gas and bloating in some people, especially if you ramp it up too fast. So the practical tip is this: if you think constipation is part of the picture, address it intelligently. Hydrate, increase fiber gradually, not aggressively. Focus on soluble fiber. Move your body, and make sure you've had a colonoscopy to rule out any obstructing lesion. And if all else fails, consider getting a pelvic floor dysfunction workup. Tip number 4, pay attention to dairy, lactose, and other food intolerances. One of the classic, very practical causes of bloating is lactose intolerance. It is normal for us humans to become lactose intolerant as we age. The enzyme to break down lactose naturally becomes more and more inactive as we age. And people often miss it because they think, I've had dairy my whole life, so it can't be that. Actually, it still can be and often is. Tolerance can vary with age, dose, gut microbiome composition, ethnicity, and what form of dairy you are consuming. A 2019 review on lactose malabsorption and intolerance defines lactose intolerance as onset of symptoms such as abdominal pain, bloating, and diarrhea after lactose ingestion in susceptible individuals. So do a complete dairy cessation trial for at least a few weeks. If symptoms don't change, then fine. Lactose wasn't the cause. But in many of my patients, completely cutting out dairy markedly improves their symptoms. And if you absolutely have to eat dairy, try some lactate enzyme supplementation and see if that provides any benefit. Some of my patients are fine with a little cheese or yogurt, but milkshake or ice cream absolutely destroys them. And dairy is not the only possible food intolerance. Some people react to certain fruits, sweeteners, supplements, or broader fermentable carbohydrate groups, such as FODMAPs, as we discussed. But lactose is one of the easiest real-world things to test first. So one of the smartest things you can do is stop guessing and start tracking. Not forever, just for a couple weeks. What did you eat? When did the bloating hit? Was there gas? Was there pain? Did you have a bowel movement? Did symptoms reliably show up after dairy or certain meals? I know, it's not glamorous. Nobody wants to keep a food or symptom journal. It's not sexy, but it works. Patterns start to emerge, and once they do, certain food triggers start to become very obvious. Tip number 5, walk after your meals and move your body. This is one of the simplest things people can start today. A lot of people eat a big meal, then immediately sit down, lie down, or take a nap, when in truth, there is a direct correlation between movement and gut motility. There is direct evidence that physical activity helps constipation and gut motility, which matters because constipation, as we discussed, is such a common contributor to bloating. A 2019 systematic review and meta-analysis found that exercise significantly improved constipation symptoms, and a 2025 systematic review found that moderate to high physical activity helped regulate the gut-brain axis and improved functional GI disorders such as bloating and abdominal discomfort. So, in practical terms, a short walk after meals makes a lot of sense, not because walking is magical, but because the evidence clearly shows that movement greatly improves motility, gas transit, and bloating. You don't need to do a hardcore workout after lunch. Just move. Walk 10 to 15 minutes. Even that simple habit may help, especially if constipation or sluggish transit is part of your bloating picture. Let's add in a few bonus tips for mistakes that often make bloating worse. Chewing gum all day can increase swallowed air. This is a clear trigger for aerophagia and bloating. Drinking through straws can do the same. Carbonated drinks are low-hanging fruit for a lot of people. Filling your GI tract with bubbles and gas when you are already bloated is a recipe for disaster. Taking random probiotics without a clear reason is usually not the answer and may exacerbate the situation. Many of my patients find that probiotics make their symptoms worse. In fact, the AGA Clinical Bloating Update notes that probiotics should not be routinely used for bloating and distension. You are much better off simply increasing the amount and variety of vegetables in your diet, which, by the way, are the prebiotics that your microbiome naturally turns into probiotics. There is a direct relationship between the health of your gut microbiome and the variety of vegetables you consume on a week-to-week basis. So when should bloating not be ignored and investigated further? Because there are definitely times when it deserves more medical attention. If bloating is associated with unintentional weight loss, persistent vomiting, blood in the stool, anemia, severe constipation, significant diarrhea, trouble swallowing, or progressively worsening symptoms, that is not something to just ignore. The AGA update emphasizes evaluating patients carefully and not missing other underlying causes when symptoms are persistent or concerning. Because yes, bloating can be and is most often related to IBS, constipation, lactose intolerance, or food fermentation. But depending on the person, it can also overlap with celiac disease, pelvic floor dysfunction, gastroparesis, small intestinal bacterial overgrowth, and other medical issues that may need further workup. So lifestyle changes are useful, but red flag symptoms deserve further investigation. Let's do a quick recap. If bloating is something you deal with regularly, here are the 5 things you can do to implement today. First, slow down when you eat. Stop inhaling food and air at the same time. Second, cut back on the biggest trigger foods, especially fermentable carbs, sugar alcohols, and carbonation. Third, make sure constipation is not the real underlying issue. Fourth, pay attention to dairy and other food intolerance patterns instead of just guessing. Keep a diary. And fifth, walk after meals and move your body. There is a direct correlation with movement and gut motility. So if you are somebody dealing with bloating, I want you to know 2 things. First, you are absolutely not alone. This is incredibly common. I see it in my patients every day. And second, you are not crazy. Bloating is not just some vague complaint people are making up. It is real, it is common, and for many people, there are clear patterns and practical interventions that can help. The modern GI literature really supports this idea that bloating is common, often multifactorial, and worth evaluating thoughtfully. Sometimes the answer is as simple as eating slower, fixing constipation, and cutting back on a few obvious trigger foods. Sometimes it takes more work, but either way, if your gut feels better, your quality of life improves. If you found this video helpful, consider subscribing to the channel and let me know in the comments below. What seems to trigger your bloating the most? Is it dairy, constipation, large meals, carbonation, or something else? What interventions have worked for your bloating? Thanks for watching, and I'll see you in the next one.